these who are healthcare tech startups, e-pharmacy companies, non-profits, journalists, and students from policy colleges across India. We will now move on to our panel discussion, and we are very privileged to be joined by four market leaders. I'll introduce our panelists very quickly. First one is Mr. Deepak Sahani, who is the founder and CEO of Healthians. Secondly, we have Dr. Prashant Nag, who is the AVP at Tata 1mg. We have Mr. Ravi Bansal, who is the head of consumer diagnostics at PharmEasy. And last but not the least, we have Mr. Saeed Kazim Ali, who is the associate director of public policy at Fractal. Thank you all for joining. My first question is for Mr. Deepak Sahani. So, e-diagnostics played a very huge role in saving lives during the COVID pandemic. What do you think is the way forward?
So I think, like you rightly said, there has been a lot more new learnings that an e-diagnostic had in terms of obviously scaling up, getting on ground, getting things done. I still remember there was a week of a lockdown, and to get those passes out and get all the players back to the market was definitely a difficult time. I think, like ma'am has just said, the time has really taught us all well, and I think e-diagnostics really helped a lot of people to access to healthcare at home. And I think the way forward now is definitely going to be the largest, I would say it's the fastest growing space where people have just realized that this is going to stay. And if I can get a better service at home, why not access it? Number one. And secondly, I think there's a lot more benefit. So a benefit of not going out, benefit of not going where the most of the patients are, benefit of lower infection rates, a lot more is what people are realizing. At the same time, the good part is these services are not coming at a premium. They're even more affordable because a lot more, if you really look at any service that is coming at home, is actually around the corner. If you look at around the country, if you look at, is actually lower cost than going to a particular center. I have not seen a particular service which is charging a premium for going at home. So it's actually also becoming more affordable, and people will actually be able to compare that and use these services more often. That's where we are moving forward to.
Thank you for that answer. My second question is for Dr. Prashant Nag. With the evolution of digital technologies, how do you think it's shaping the e-diagnostic sector?
Hello. Good afternoon, everybody. So, as far as technology is concerned, technology is basically a tool which is touching and revolutionizing all our lives in all spheres. So, healthcare services are becoming increasingly tech-enabled, and digital health has the potential to transform the way we are dealing with healthcare. So, our basic goal of making accessible, affordable, and quality diagnostics, in that case, the technology is going to be an answer. Just to understand the scope of the problem, India we have a humongous population of 150 crores, and on that, the basic number of operational labs is somewhere around 1 lakh. So that makes around 40 labs per million of population, which is far lower than a developed country like US, which is around 400 per million of population. And again, out of these 40, the quality infrastructure is again a question. So to make that quality infrastructure accessible, technology is the only thing which can work. So if you look at the journey of diagnostics, specifically if I go to e-diagnostics, the first thing is the knowledge about the test, its availability, possibility of collection at convenience, then online payment, coming of the digital report, and finally the digital maintenance of the health record. These all are possible only if we have an integrated layer of technology with e-diagnostics. So I think to sum up, goal to make an healthcare versatile, well-utilized, and ubiquitous, it is very much important that e-diagnostics become an integrated part of the whole this healthcare system. And as today what we are doing, that self-regulation part, we should take big steps in it.
Yes, I completely agree, and I want to segue from there to our next panelist, Mr. Ravi Bansal, and ask him about the transition that has happened for our consumers. How has COVID played a role of a catalyst, and how do other stakeholders now in the industry play a very constructive role going ahead?
Sorry, Rahul, I missed you in between. Can you repeat the question, please?
Yeah. My question is that with the new the traction that e-diagnosis is getting during COVID, and also the you know the sorry, and also the other catalyst in the industry, where do you see the role of all the stakeholders coming together to promote e-diagnostics?
Okay. And with stakeholders, you mean the other e-health players?
Yeah, I mean the companies, the consumers, the other retailers, and also the other players in the market, the think tanks as well.
Absolutely. No, as everybody pointed out, that e-diagnostic or the recent COVID has, really propelled the e-diagnostic penetration across consumer, which would have taken maybe 2-3 more years to get to the level, where we are today. And people are much more friendly in, getting somebody to come to your home and collect the blood samples. But I see while e-diagnostic has definitely grown, and the growth rate some of us talked about is really, really, stupendous, and all of us are banking on that. But there is going to be an omni-channel experience eventually that will sort of exist, right? And we are also investing not just in e-health experience, but also in offline experience, because customers will continue going, in the offline setup to meet a doctor, to get their blood test done, to buy medicine, etc. But how can we integrate that both of the channel can coexist, right? And eventually, even a retailer who is sitting, we are now collaborating with them too, so that they also have the capability to book test on our portal. So they also become the demand generator for us, and eventually also get benefited out of this entire ecosystem. So I think eventually it's not just going to be e-diagnostic, it's going to be the entire ecosystem of offline and online coming together, which will have all the doctors, all the retailers, be it medicine providers, all will come together and support this ecosystem. And e-diagnostic will, of course, will become, because one of the big enablers because of the convenience, etc. But ultimately, whether a customer is walking into an offline center or online center, all the experience should be seamless. The report should be available in one place, which is some of the initiative like Ayushman Bharat, etc. are also trying to get to. Wherever customer is going, eventually all the data is clubbed into one place. So I think eventually e-diagnostic growth will be driven by all the stakeholders, whether it's sitting in a store or sitting online, and all of us have to come together. So that's what my point of view is there. I hope it answers.
Yes, absolutely. That was very insightful. I have another question for Mr. Said Kazim Ali. Uh, you're representing a company which provides e-diagnostic services. How do you think has the pandemic transformed your company?
Well, thanks for the question, Rahul. Good afternoon, everyone. And thanks to FICCI, first of all, for launching this very important document, the Diagnostics Code of Conduct. See, COVID pandemic has been a testing time for all of us, and we have gone through a lot of issues. Everybody has faced a lot of difficulty during this pandemic. But one thing which COVID pandemic has made us realize is the importance of digital healthcare, including e-diagnostics more so. At a time when testing a virus by maintaining social distancing was one of the major factors for the control and treatment of this pandemic. Home-based COVID test sample collection offered by companies involved in e-diagnostics was definitely a game changer in fighting and containing the pandemic. Large-scale COVID testing was successfully done by the health tech companies involved in this business by well-trained phlebotomists, where people didn't have to visit the hospitals or healthcare facilities, thus reducing the spread of infection, and especially for people who are elderly, children, pregnant women, people with chronic diseases. So it has immensely helped in reducing. It has also immensely helped in reducing the existing physical burden on the healthcare infrastructure of the country during the pandemic. Uh, Having said this, I would like to add that as India plans to revamp its healthcare, first of all, it's like remarkable and commendable to see various recent initiatives taken by Government of India to use technology for making quality healthcare affordable and accessible to all. ABDM is an example of this. So as India plans to revamp its healthcare system, it is important to set a clear and bold vision, the one which places the patient at the center of the care. We should envision a futuristic journey where the patient gets uninterrupted access to quality healthcare across the care continuum, irrespective of his location, income, gender. And to do this, digitization and innovation throughout the healthcare ecosystem is the key to achieve this vision. As it's very heartening to see the support which the government is providing us. But the need of the hour is to simplify and expedite the growth of the healthcare sector in India with the right fillip and conducive policies. Digital healthcare has huge potential to add immense value to the overall healthcare ecosystem of the country, and also realizing the goal of universal health coverage. Way forward, I would say it is very important to get the online diagnostic services providers accredited. By doing so, as ma'am said, Ms. Nanda said, the customers will be the biggest beneficiaries, as standardization of services will often offer them more world-class convenience, transparency, and make the cost of healthcare more affordable for the masses. Thank you.
Thank you, Saeedji. I want to take this opportunity because we are here with Joint Secretary Ma'am, Mrs. Manmeet Nanda. If the panelists would like to make any submissions on behalf of the industry or the ecosystem, they can please go ahead and use this time.
If I may add here.
Sure, Saeedji, please go ahead.
Ma'am, it's a humble request from our side. See, as a first step, FICCI has done a wonderful job in preparing and releasing this self-regulatory voluntary code of conduct on e-diagnostics. We would suggest and recommend if we could please get your support in, preparing and coming out with some sort of a guideline on e-diagnostics, similar on the lines of the guideline on telemedicine, which was released by Ministry of Health in 2020. That would be really helpful, ma'am.
Sure, sounds like a very good initiative. Have you been in touch with the Ministry of Health in this regard?
No, ma'am, we haven't been in touch with the Ministry of Health for this particular piece, but FICCI, if Rahul, correct me if I'm wrong, FICCI had been in touch with DPIIT, ma'am, earlier. We had a few rounds of discussion also, we proposed this idea to DPIIT, and they were, the ideas were well received by DPIIT at that time, and I believe we also had exchange of one or two notes as well over mail with DPIIT through FICCI. So I guess Rahul, correct me if I'm wrong, that is the situation right now, ma'am.
We can reinitiate this discussion further. Not a problem.
Wonderful. Thank you so much, ma'am. Really appreciate it. Thank you.
Thank you, Saeedji. Would anyone else like to add on? Or we can move to the last part in interest of time. We will have concluding remarks from Mr. Ramesh Juneja, who's a senior.
Rahulji, just before the concluding remarks, I am using this forum to ask all the people present here, since I also look after ease of doing business regarding this particular sector. Is there any specific issues that you face in terms of compliances that you feel are unnecessary or maybe burdensome in a way? Do not respond to me right now. I would not want an off-the-cuff answer right now. Sit together as a team. You can sit with FICCI's leadership. Decide on what specific issues that you face in terms of compliances that you as an industry face, and if there can be any methods in which we can simplify the procedures, we will be happy to take in your inputs on that regard.
Definitely, ma'am. That will be great.
Oh, ma'am. Yeah, that'd be really helpful. Yeah.
Thank you, ma'am. Lastly, I would like to invite Mr. Ramesh Juneja, who is the Senior Vice President at Reliance Retail Pharma NetMeds, to give the concluding remarks.
Thank you. Thanks, Rahulji. Before I say thanks to all of you and the audience who are attending via YouTube, I'd like to say my sincere thanks to Honorable Prime Minister Ji, who has taken health and economy hand in hand towards Mission of Swasth Bharat, Sashasth Bharat. I was privileged to part of last month in Ahmedabad and attended Ayush Global Summit, where Mr. Modi ji, the Honorable Prime Minister was present. His vision towards taking holistic healthcare is clearly coming up with the Ayush visa and a lot of other initiatives. What has been shared by him to all of us in the summit, it was clearly reflecting that India is going to be somewhere today or tomorrow global healing place for the world. People will look towards us as a healing country. It's not only towards allopathy, it's going to be a complete healing solutions we'll be able to provide to the globe in India. That's what the initiatives clearly reflected from our Honorable Prime Minister's talk there. The last, I'd like to convey my sincere thanks to Honorable Nandaji for releasing this code of conduct, which is the need of the hour. We know that quality consciousness is growing. Teleconsulting is growing very fast. We all has witnessed that. And I, based Mumbai, I see my life has become very easy. My parents, ailing parents, are in Delhi. Today morning itself, I consulted through the doctor, was able to book diagnosis yesterday and was able to conclude all the things what is required for the health of parents. But yes, we used to feel that there's some regulations is required to control everything and to bring every entire ecosystem together. And today, this is the first step towards that. Thankful to each one, all the dignitaries who spared their time for this session, for sharing their thoughts together, which will definitely help everyone in this room towards right health, right diagnosis, and this will help us in reaching to the rural market tomorrow. I was reading a today's morning article about internet penetration across the country today. Out of 2 females in the rural market, 1 is using internet today via mobile. That's where we all can reach through teleconsultants and diagnosis tomorrow. Need is immense. The way the Ayushman Bharat vision has been flouted. It's not only I go with my colleagues who stated clearly, physical and digital both has to work hand in hand for the better healthcare in the country. And this first code of conduct towards e-diagnosis, and second, what is expected, what Madam has told, she will take it up further towards e-teleconsultancy, some regulations, which will help tomorrow to bring everybody together towards one mission of better health for everyone. And we'll able to reach to each person in the country who require right diagnosis at the right time. Thanks to everyone. I appreciate FICCI for initiating this talk today. And thank you, Madam Nanda, once again to everyone. Rahulji, hand over to you.
Thank you, sir. And thank you, Manmeet ma'am, for your time, and to all the panelists for joining us. With that, we'll end. Thank you.
Thank you.
We can end the session.
Thank you. Thank you.
Thank you.
Thank you.
Thank you, everyone. Thank you.
Thank you.
Video off. Video off.